going to discuss about inflammation of eyelid glands. So coming to today we are going to discuss about external hardiolum, internal hardiolum, and chalazion. Okay, internal hardiolum and uh, their complications, treatment, everything we will discuss, and molluscum contagiosum we will discuss today. Okay, so without any delay, let's start. So what is external hardiolum? It is acute suppurative inflammation. Suppurative means there is formation of pus of the eyelash follicle and its associated glands of G's and mole. G's are basically sebaceous glands, whereas mole is sweat gland, which is located at the end of the hair, means eyelash hair will be, that, and it opens into the ducts of the G's glands. So what are the so if you want to appreciate, you can appreciate the glands of G's and mole. So then we can clearly, and I will do another video on that eyelid anatomy and everything. So here are the G's of mole and here are the G's of G's, glands of G's, and here is glands of mole. Glands of mole are opening into the ducts of the G's glands. Okay, and this is about that picture. So coming to what are the predisposing factors whom you will see. Okay, one is children, young adults, patient who are with eye strain due to muscle imbalance or any refractive errors like myopia, like that, and habitual rubbing of the eyes, and fingering of the lids and nose, chronic blepharitis, eyelid inflammation, and diabetes due to immunosuppression, some metabolic factors like chronic disability, excessive intake of carbs and alcohol. Okay, like causative organism is staph aureus, and any suppurative infection mostly will suspect that it is caused by generally staph aureus. Okay, what are the clinical features, symptoms? It is acute, right? Acute, and there is a pus and there is inflammation. What are the signs of inflammation? In inflammation we will have pain, redness, swelling, and these three are common, right? Rise in temperature, and we have redness. So here also the same, pain, mainly we will see swelling of the lid, watering, and photophobia. What are the stages? Here we will bother about two stages. One is stage of cellulitis and another one is obviously suppurative. There will be pus, so abscess formation stage also will be there. So what is the treatment? So treatment for this is hot compression. So if it is in the stage 1, which is cellulitis stage, we'll do hot compresses 2 to 3 times a day, and evacuation of pus. We saw it is suppurative inflammation, so we'll drain the pus here. So we'll remove the involved cilia. Surgical incision, rarely will do incision for large abscess if it is present, and antibiotic eye drops will use 3 to 4 times a day, and eye ointment at the bedtime we should apply, and systemic anti-inflammatory and analgesic will use. Anti-inflammatory to relieve from the inflammation, and analgesics to relieve from the pain. Systemic antibiotics to control the infection in recurrent stage. Okay, chalazion. What is now coming to chalazion? It is tarsal or meibomian cyst. Again, meibomian glands. You will find meibomian glands. In that meibomian glands, you will see this meibomian cyst. Okay. Here they are meibomian glands. See, these are meibomian glands. Okay, so this is non-infective, unlike that of external hardiolum, and lipogranulomatous inflammation of the meibomian gland will occur. So what are the etiology? Means in children it will occur, in adults it will occur, and in diabetes it will occur, in metabolic disorders like in alcohol, alcohol toxication and excessive intake of carbs it will occur, and constant rubbing of the eyes or fingering it will occur. So what is the pathogenesis? First, it will occur as mild grade infection of the meibomian gland, which is caused by organisms of very low virulence. Okay, and what will happen then after the infection means the epithelium will get proliferated, and infiltration of the walls of the ducts infiltrated by neutrophils and everything, and the secretions will retain in that gland, which leads to the gland enlargement, and it looks like a cyst formation there. So pent up and extravasated secretions irritate and excite non-infective lipogranulomatous inflammation. It acts as an irritant, and they will provoke the inflammation, which is lipogranulomatous, and it is non-infective, whereas infective in the external hardiolam. So inflammation of the blocked meibomian glands and surrounding tissues. What are the clinical features? Obviously it is non-infectious, so no pus, no pain, so no, painless. There it is pain, here no pain. Swelling in the eyelid, gradually the size will increase. So mild heaviness will be there, blurred vision. Okay, sometimes induced astigmatism may also occur due to the large chalazion of the lower lid. The chalazion occurring in the lower lid, it may provoke to astigmatism, where the person can't see both horizontal and vertical lines at a time. So signs, what are the signs? Nodule will be slight away from the lid margin, where it is not away from the lid margin in case of external hardiolam. It is form hard and it is non-tender. Upper lid is more involved than lower lid, because upper lid contains more number of meibomian glands. Okay, multiple chalazion will be seen in the upper eyelid, and reddish purple area will be seen in the palpebral conjunctiva after the eversion of the lid. Projection of the main bulk of the swelling on the skin side will occur. Marginal chalazion, smallest reddish nodule will be seen in the marginal margin. Okay. So next chronic. So these all are the chalazion. What are the clinical course and complications? It already we saw there is gradual increase in the size. It becomes very large, fungating mass of the granulation tissue. Secondary infection may lead to hardiolam internum. Calcification occur rarely. Malignant change, meibomian gland adenocarcinoma may occur if no treatment is done. So what is treatment? First we will do conservative treatment in initial stages, like hot fermentation, topical antibiotic eye treatment, and oral anti-inflammatory drugs like aspirin and all. And another one is intralesional injection of long-acting steroid will do. Okay, long-acting steroids like triamcinolone will give prescribed, and incision and curettage. So what we'll do, we'll give incision. So we'll do both incisions. One is horizontal and another one is vertical incision. Horizontal incision is at the skin to prevent the scar appearance, and vertical incision will give at the conjunctival site. Okay, we'll give incision, and after before incision giving we'll do local anesthesia, like okay, local anesthesia will give like xylocaine, and we'll procedure with the incision as we saw. Vertical and horizontal incisions will give. We'll remove that with chalazion forceps, and after that we'll again wash it with normal saline, and we'll pack the thing. Okay, so diathermy will do. Thermy means temperature by giving it to heat and removing it, giving heat to that place, we will remove that. Oral tetracycline also we will give. So internal hardiolam, it is suppurative, where chalazion is non-suppurative. It is suppurative as that of external hardiolam, so of the meibomian glands, and it is associated with the blockade of the duct will be blocked. What is the etiology? So same to that of external hardiolam, like children, young adults, diabetes mellitus, constant rubbing of the eye, and metabolic factors like alcohol. So what are uh, what are the bacteria causing it? Means staphylococci infection of the meibomian gland. Second infection, if the chalazion got infected, it may lead to complication as internal hardyolum. Okay, what are the clinical features? Pain will be there, obviously, swelling, whereas painless in the chalazion, mild watering, photophobia, fear to light. Swelling is embedded deep into the dense fibrous tissue. So we are calling it as internal. Means it is embedded deep in the dense fibrous tissue. What are the signs? It is localized, red, tender, and form. Swelling of the lid associated with marked edema. On examination, maximum tenderness will be and swelling which are away from the lid margin as that of chalazion, also away from the lid margin. So pus usually points on the tarsal conjunctiva. So differential diagnosis, we should differentiate it from the hardyolum externum. Treatment is similar as we saw, conservative treatment, triamcinolone, long-acting steroids, incision curettage, uh, is all for chalazion, right? Uh, so for hardyolum externum, what we did, the conservative treatment like hot compresses, antibiotic eye drops, systemic anti-inflammatory drugs, aspirin, those all we should give for hardyolum externum. At a point you also confused, right? So for external hardyolum, we are antibiotic and conservative like hot compresses. Okay. Drainage by vertical incision from the tarsal conjunctiva. Molluscum contagiosum, it is caused by pox virus. Clinical features will be multiple pale waxy umbilicated swellings which are scattered all over the skin near the lid margin. What are the complications of it? It may turn into chronic follicular conjunctivitis and superficial keratitis. We even saw a case in dermatology, molluscum contagiosum. Mainly we'll conclude it as molluscum contagiosum by seeing the umbilicated lesions. Okay, where we saw in that case below the lower lip there are some few lesions which are like papules. Those we'll see there. So which are umbilicated lesions, umbilicated so complications are chronic follicular conjunctivitis and superficial keratitis if untreated. Treatment should be incised and cauterization should be done with the tincture of the iodine or pure carbolic acid. Okay, there in chalazion also we'll use carbolic acid and after we'll before packing we'll use carbolic acid also. Okay, these are the today we saw external hardyolum, internal hardyolum, chalazion and molluscum contagiosum. So non-suppurative is chalazion, whereas suppurative is external and internal hardyolum, and molluscum contagiosum is viral infection. Remaining all mostly associated with staph aureus, and as complication of chalazion, internal hardyolum is developing. So in chalazion and internal hardyolum are always away from the lid margin. So these are important, and mostly we'll see painless is in chalazion, remaining are painful. Okay, painful lesions, and should able to differentiate between hardyolum externum and internum, and treatment part is important. These are eyelid uh, anomalies today we saw. Okay, thank you guys, thank you.